convention in 1976 in Philadelphia. That was where the Legionnaires got together in this really interesting, cool, historic old building down in Philadelphia, but sadly, hundreds of them developed pneumonia, and they couldn't figure out what it was. This is kind of interesting. They literally called the mystery killer. They couldn't figure out what was causing this. We know now it was this particular bacterium, which is a gram-negative rod. It's ubiquitous in wet environments. That means this is an organism that lives in the environment. So natural environments like streams and ponds have it, with fresh water, by the way, fresh water. Where the people in this outbreak got it from, though, was from the air conditioning unit. So it was aerosolizing this stuff, and these guys were getting sick and dropping like flies, and it actually killed, I forget how many actually died of it, that particular outbreak. Spas, humidifiers, showers, fountains. So if you want to see, this is a human interest one, but if you want to see a current outbreak of Legionnaire's disease from a hotel fountain in the lobby, they had this water feature, and it was aerosolizing Legionella, and I forgot how many, not that many people got sick. Bottom line is anywhere where water gets aerosolized. So I always think about Legionnaire's disease, like in the summer, if you go out to Palm Desert and you eat in a restaurant and they have those little misters, you know what I'm talking about? I always sit there and go, ooh, Legionnaire's disease. But it doesn't stop me. It doesn't stop me because the most common person to get this disease, for whatever reason or other, older male smokers, and believe me, they had all of those together at the Legionnaires convention, meaning they're an older person who smokes, and that's not good for your lungs, and they have a increased risk. So also people that are immunocompromised. The symptoms are, like regular pneumonia. So you have, fever, cough, chest pain. This one, though, has an extremely high fever. So 104, 105. 104, 105 in an adult is seriously high fever. That's like put that person in an ice bath because their brain is going to melt. That's very seriously high fever. And those that do survive of this have often permanent lung damage. That means even though they survive, they no longer have their same lung capacity that they had before. So in the U.S., we have on the order of 20,000 cases of Legionnaires every year. So I mean, it is a significant disease. So the fatality is like 30%. 30%, not on the test. It doesn't say it there, but about 30%. Treatment is erythromycin. So like the Z-Pack usually works. And when that first outbreak occurred, they didn't know really what was going on. So check out this one. Check out these clinical case histories in the lecture book because they sometimes appear on the test. So guys, what sort of a stain is that? That's a fluorescent antibody stain. So if you can get a sputum and test it with the antibodies to Legionnaires, you can get a diagnosis. So I am just going to show you this table. Don't memorize this table. Why do I show you the table? Well, we talked about everything except for these last three. Don't even worry about these last three. But I want to point out that all of these things cause pneumonia, but they're treated differently. So that means when someone's in the hospital with pneumonia or in the ER, they want to know what's causing it, so they give them the appropriate treatment. So again, a serious pneumonia, they want to have a gram stain at least. They want to culture it, so they're giving the person the right antibiotic. Because you'll notice here different antibiotics for each of these. Okay? So I'll see some of you over in lab. The rest of you, I'll see you on Wednesday.
Professor, thank you.
Yeah, you're welcome.
This table is not going to place.
No, but I talked about 1, 2, 3, 4 of them already. Yes.
You want to go to the cafe?